background on the HIV and AIDS situation in Zambia, as of 2007, there were 1.1 million people in the country of Zambia living with HIV and 860,000 people living with AIDS in 2001. The HIV prevalence rate is about 15.2% as of 2007, and that's countrywide. Where I worked in Livingston, it was a very modernized type city, and also it was kind of a tourist town. It was right by Victoria Falls. So within the actual city of Livingston, they estimated the HIV prevalence rate to be about 30%. In 2007, there were 56,000 deaths in Zambia due to AIDS, and as of 2007, there's an estimated 600,000 orphans living in Zambia due to the AIDS problem. While there's issues with treating AIDS medically, there's also the larger scale issues that come about because of HIV and AIDS, and this includes stigma about HIV infection and testing. And this is really a problem when you're trying to get an accurate measure of what exactly is going on, trying to get prevalence and incidence rates in order to see which communities are most in need and things like this. And when there's a stigma about HIV testing and people are afraid to get tested because their neighbors will think, well, if you got tested, then you have AIDS, or if you got tested, then you cheat on your wife. It really prevents us from getting any solid knowledge about the situation. There's also misconceptions and myths about transmission and treatment. There are some urban legends where if you have sexual intercourse with a young white girl or a virgin, you'll be cured of AIDS. And these things are really difficult to get out of the popular belief because the ARV drugs, the antiretroviral drugs they are used to treat, do help in preventing the progression to AIDS, but it's very hard to see tangible benefits. So people are very likely to think, well, this isn't working, let's try something else. And they will listen to their neighbors when they hear old wives' tales. There's also a general lack of health education and a lack of resources in terms of transport to and from medical facilities, medications, personnel, and training for those personnel. And specifically with the trained personnel issue, there's a large issue with a brain drain in Zambia where the government is subsidizing a large portion of education costs for doctors and nurses. But as soon as these people graduate from their medical school or their nursing school, when they have a few years experience, they can move next door to Namibia or Botswana to be paid almost 10 times as much for working the same job. So it's very difficult to keep qualified health professionals in the country. The last piece of background I'm going to talk about is HIV TB co-infection. Tuberculosis is a very common bacterial disease that's mostly respiratory, and it's seen very commonly infected with HIV. It's one of the opportunistic infections that's seen very commonly, and we see it in a lot of our home-based care patients that we worked with through African Impact. Worldwide, HIV infection, TB is attributable to HIV infection. That is, the TB infection is caused by the HIV in 12% of TB cases, and 11% of AIDS deaths worldwide are caused by TB infection. Because, as most of you probably know, you can't actually die from AIDS. What happens with AIDS is the immune system becomes so depleted that an infection that normally the body could fight off becomes what eventually actually kills that person. And a quote I got from an article on the growing burden of tuberculosis worldwide is that the HIV pandemic presents a massive challenge to global TB control. And one optimistic thing about home-based care, which I'll go into a little more in the next parts of my presentation, is that home-based care has been proven to increase adherence to TB medication and reducing contagiousness and further spread of the disease. And this is really important to keep in mind because the thing about tuberculosis is it's very contagious until it's properly medicated. Once you've been on the medication for TB, which is about 6 months solid of antibiotics, once a person has been on these medications for 2 weeks continuously, they're no longer contagious. But if they miss doses or things like that, if they don't adhere to the program, they're once again contagious. So it's very important that we keep people adhering to their medications. Otherwise, not only are they not getting better, but they're further spreading the issue. And next is just a literature review of studies that have been reviewing the effectiveness of home-based care programs. First, looking at some positives, a prospective study looking at the HIV and TB co-infection showed that, once again, or home-based care resulted in very high adherence to both TB and HIV medications, meaning that these people are not only most likely getting cured of their TB, preventing the spread of TB, but they're also delaying through the antiretroviral medications they're taking. They're also delaying the onset of AIDS from their HIV positive status. A cross-sectional case control study looking at virological failure, and that is just a specific measure of the progression of the disease. Home-based care was shown to be just as effective in treating HIV than facility-based care. So this really showed that this home-based care program that they were using was able to prevent the progression of HIV to AIDS just as efficiently as people who were seeing trained nurses and physicians regularly. Home-based care has also increased knowledge and understanding of general health issues, such as knowledge of HIV medications, kind of how they work, what side effects to expect with them, and then also treatment and prevention of diarrhea, which is actually a huge killer of children in many of developing worlds, especially in sub-Saharan Africa, and also reduction of HIV stigma. So in addition to treating their regular just medical ailments, it can also very effectively serve as a health education tool as well. And lastly, home-based care was shown in Kenya at least to have a higher increase in quality adjusted life years than facility-based care and mobile care clinics. So in this study, they studied the quality adjusted life years of how long people, after being tested HIV positive, how long they lived after that point. And home-based care was proven to be just as effective, if not more, than both facility-based care, which is traditional, go to the clinic, see a clinical officer, a doctor, and mobile care units where nurses and doctors were brought around to supporting villages. Of course, there's always going to be some negatives. Clearly, there's the issue of community members are not trained doctors or nurses, so there's always going to be fallbacks from that. Volunteers in Tanzania reported experiencing extreme stress, burnout, and discrimination due to HIV stigma. And this is a real problem because with any type of situation, if you have people working in one kind of monotonous thing, this is always going to happen. But increasingly, if they're community volunteers and they're not getting paid for this type of thing, it's even easier for them to kind of not see the point and want to quit after things get a little stressful. Volunteers also complain about discrimination against their patients, that is the people living with HIV or AIDS, lack of money, food, medication, transport, and healthcare facilities. And this is a really big problem because a lot of the people we saw in Zambia, their healthcare situation was okay. They had their ARV drugs and their TB medications, and they stuck to them all right, and they didn't have any other infectious diseases, but they were living in such abject poverty that they can't handle taking their HIV medication because the side effects are so strong on an empty stomach that they just vomit everything back up, or they can't handle the side effects on an empty stomach. So a lot of volunteers through these programs have requested maybe co-sponsoring through the World Food Program or other types of basic needs programs to help increase the overall health of their patients. And lastly, the one that I thought was most important was the health risks that were taken by home-based care volunteers. Because, once again, these people aren't trained medical professionals, a study in Kenya showed that 85% were unaware of the health risks they were taking while caregiving for people living with HIV or AIDS. 24% of these people tested positive for HIV and or positive for TB, and most importantly, 8% tested newly HIV positive. And the study revealed that because these people had been sexually inactive, it was determined that most likely this HIV infection was because of their association with this home-based care program and because they were improperly handling blood or their body fluids.